Hi, today's topic is chronic constipation. And chronic constipation is defined as unsatisfactory defecation. This is usually accompanied by less than 3 bowel movements per week, and it is also accompanied by difficulty passing stool. And difficulty passing stool includes symptoms such as straining, a feeling of incomplete evacuation of the bowel, a feeling of blockage of the bowel, manual manipulation to assist the passage of stool, lumpy hard stool. These are all symptoms that patients with chronic constipation have. Now, in order for it to be classified as chronic, these symptoms should be present for at least 3 months out of the past 12 months, the prior 12 months before the diagnosis is made. Chronic constipation is also associated with other symptoms which are not related to the gastrointestinal tract, such as psychological distress, anxiety, depression, obsessive compulsiveness. Patients with chronic constipation sometimes have psychoticism, and psychoticism is a mild antisocial trait that is found frequently in these patients. There is also a high incidence of somatization. Somatization is the manifestation of physical disease that has an etiology that is psychiatric. Patients with chronic constipation frequently have bulimia and anorexia and a history of physical and sexual abuse. Other symptoms that accompany chronic constipation include functional gastrointestinal disorders such as functional dyspepsia and functional heartburn, and GERD, which is gastroesophageal reflux disease. Serious complications can occur from chronic constipation, and one of the most frequent is fecal impaction. Fecal impaction in elderly patients especially is a very severe condition. Fecal impaction means that the stool is hard and has formed a blockage in the bowel, preventing the movement of stool in the bowel. This can lead to symptoms such as confusion and deterioration in the patient's general condition. These patients have nausea and vomiting, they have bloating, and impaction can lead to ulcerations of the bowel wall, which eventually can lead to perforation of the bowel wall. And bowel perforation can cause peritonitis and death. So these are serious complications of constipation that can occur if fecal impaction occurs. Chronic constipation also has indirect costs, and indirect costs to society include decreased work productivity, absences from school, lower quality of life, and psychological distress symptoms. This is a brief overview of chronic constipation. We shall continue in the next video by discussing the causes of chronic constipation. Thank you for watching.